So let's talk about the next drug, which is amoxicillin trihydrate potassium clavulanate. So the famous brands include Augmentin, BD tablets. So for example, for Augmentin 625 mg tablets, each tablet contains 500 mg of amoxicillin in the form of amoxicillin trihydrate, and 125 mg of clavulanic acid as potassium clavulanate. That's for 625 mg tablets. As for the Augmentin 1 gram tablet, each tablet contains 875 mg of amoxicillin as amoxicillin trihydrate and 125 mg of clavulanic acid as potassium clavulanate. So the pharmaceutical form for Augmentin 625 mg tablets are a white to off-white oval shaped film coated debossed with AC, okay, and blah 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 blah, not so important. And similarly you have of course the Augmentin 1 gram tablets, also an oval white oval film coated tablet. So clinical particulars indication. So Augmentin is an antibiotic agent. Okay, it's a broad spectrum antibiotic can be used against the commonly occurring bacterial pathogens in GP and hospital setting. So the beta-lactamase inhibitory action of clavulanate, okay, it extends the spectrum or the coverage of amoxicillin to embrace, okay, it makes it cover a wider range of organisms. It's able to handle a wider range of organisms, including organisms including many organisms that are resistant to other beta-lactam antibiotics. So the oral presentations of the drug for twice daily dosing these are indicated for short-term treatment of bacterial infections, including URTI, upper respiratory tract infections, including ENT infections. So these URTI include tonsillitis, sinusitis, and also otitis media, infection of the middle ear. And then we have the lower respiratory tract infections, such as acute exacerbation of chronic bronchitis, and then bronchopneumonia and also lobar pneumonia. And then genitourinary tract infections, GUT infections, including urethritis, cystitis, okay, and also pyelonephritis. And then skin and soft tissue infections, example boils, abscesses, cellulitis, and also wound infections. Bone and joint infections, example osteomyelitis. Dental infections, example dentoalveolar abscess. And other infections, example septic abortion, puerperal sepsis, and also intra-abdominal sepsis. So susceptibility to this drug will vary, of course, with time and also location. And we should consult local susceptibility data if it's available, and also do microbiological sampling and susceptibility testing when necessary. Dosage and administration. The usual dosage for treatment of infection, adults and children over 12 years. For mild to moderate infections, 1 Augmentin or 1 tablet of amoxicillin trihydrate plus potassium clavulanate, 625 mg tablet twice a day. For severe infections, 1 gram tablet twice a day. And you can start the treatment with giving parenteral injections first, okay, followed and then continued with an oral preparation. So the dosage in dental infections, example dental alveolar abscess, for adults and children above 12 years, one tablet, 1,625 milligram tablets twice a day for 5 days. And the drug, the augmentin, for example, 625 milligrams and 1 gram tablets are not recommended in children of 12 years and under. The dosage of the drug in renal impairment, okay, so that will be according to the so if the 1 gram tablet should only be used in patients with a reading of more than 30 mL per minute of glomerular filtration. Okay, so for patients with mild impairment, that is creatinine clearance of more than 30 mL per minute, no change in dosage is required. So you can either use a 1,625 milligram tablet twice a day or 1 gram tablet twice a day. That's for mild impairment. Then for moderate impairment, patients with creatinine clearance of 10 to 30 mL per minute can give 1,625 milligram tablet twice a day. You shouldn't give the 1 gram tablet. And for severe impairment, that is creatinine clearance of less than 10 mL per minute, shouldn't give more than 625 milligram tablets every 24 hours. Okay, so 1,625 milligram tablet once a day, not more than that. Dosage in hepatic impairment, you have to give the drug with caution, monitor the liver function at regular intervals. Administration of the drug, it should be swallowed. The whole tablet should be swallowed without chewing. If required, the tablets can be broken into half and swallowed without chewing again. So it's recommended to take it at the start of a meal, okay, to minimize potential GI intolerance. And the absorption of the treatment of the drug is optimized. The absorption is optimized when taken at the start of a meal. So you shouldn't give the treatment for beyond 14 days or beyond 2 weeks without reviewing the patient again. So this drug is also available as intravenous and in an intravenous form for the short-term treatment of bacterial infections and also for prophylaxis against infection, which may be related to major surgical procedures. And it's also available for the augmentin form. It's also available as a suspension for 3 times a day dosing for administration to children under the age of 12 years for treatment of infections, bacterial infections. So with regards to contraindications, of course you can't give this in patients with a history of hypersensitivity to beta-lactams, example penicillins and cephalosporins, and also in patients with a history of jaundice or hepatic dysfunction associated with taking this drug. Warnings and precautions. So a careful inquiry should be made with regards to previous hypersensitivity reactions to penicillins, cephalosporins, and other allergens before initiating this treatment. And serious and occasional fatal hypersensitivity reactions have been reported in patients on penicillin therapy. And these are more likely to occur in patients with a history of penicillin hypersensitivity. So this drug should be avoided if you suspect the patient having infectious mononucleosis. because there is it's linked to formation of a rash, okay, following the use of amoxicillin. So if you have infectious mononucleosis, it's known that if you take amoxicillin, okay, such as what is contained in this tablet, you might develop some form of rash. And prolonged use of this drug of amoxicillin plus clavulanate, okay, administration of this drug may result in overgrowth of non-susceptible organisms. And it has been reported, pseudomembranous colitis has been reported. So you might see a mild to life-threatening pseudomembranous colitis. So always consider this diagnosis in patients who develop diarrhea during or after the use of this antibiotic or other antibiotics. Or if prolonged or significant diarrhea happens, or the patient feels abdominal cramps, then you should discontinue the drug immediately and investigate the patient further. And abnormal prolongation of prothrombin time, okay, with increased INR, have rarely been reported in patients taking this drug and with oral anticoagulants. So you might want to adjust the dose of oral anticoagulants. So this probably is part of the direction part, the talk, okay. So you might want to adjust the dose of oral anticoagulants when you also take together with the anticoagulants this drug amoxicillin plus clavulanate to maintain the desired level of anticoagulation. You might observe changes in liver function tests, okay, in some patients, and it should be used. This drug should be used with caution in patients with evidence of hepatic dysfunction. So you might develop cholestatic jaundice, which may be severe but usually reversible. So this is again rare. So, and signs and symptoms of this condition may not be clear for up to 6 weeks after the treatment has stopped. So in patients with renal impairment, you can refer back to what we have been talking about in the previous section. So in patients with reduced urine output, crystalluria has been observed very rarely, mainly with parenteral therapy of this drug. And during the administration of high doses of this drug, it is advisable to maintain adequate fluid intake and urinary output in order to reduce the possibility of amoxicillin crystalluria.